Right now on KPIX5 and streaming on CBSN Bay Area. Scientists say something called convalescent plasma may hold promise in treating people with the coronavirus. Good evening, I'm Elizabeth Cook.
And I'm Alan Martin. KPIX5's John Ramos tells us research is being held up by the current lack of testing.
As health officials struggle to find effective ways to fight COVID-19, there is a growing belief that one solution may lie with those who have already recovered from it. Burlingame police officer Steve Vega is back at work now after a 3-week battle with the coronavirus. Once he tested clean of the virus, Vega took it upon himself to call Stanford Medical to see if his blood could be of use to their research.
They were very excited to have my plasma because I believe from what they were telling me I'd be one of the first phases to provide this, and that's even more a great feeling that knowing I'm one of the first.
Plasma is the fluid in the bloodstream that carries red cells and antibodies throughout the body. There is hope that convalescent plasma, drawn from people who survived the virus, can help those who are still sick, as 60 Minutes correspondent Scott Pelley reported last night.
In theory, if you give a large enough dose and early enough in the disease process, the antibodies in the convalescent plasma will neutralize the viral particles in the bloodstream of that individual. And that could lead to a more mild course of disease, and it could lead to fewer complications.
But remember, Officer Vega had to do this on his own because there is no current organized antibody testing to even identify those who may have recovered from the disease. The Vitalant Blood Center in San Francisco collects plasma every day and says it is ready to take donations from recovered patients, but it will be up to them to come forward.
People have to, go out and find that test and get the antibody test that proves that they had COVID-19 and that they're fully recovered from it. Once that is done, they can come in and they can donate and possibly help a critically ill patient who's currently battling COVID-19.
Until there's a more unified effort, Officer Vega is hoping other survivors will step up to donate so he can be the first, but not the only one.
Because there's a lot of people out there, in this country or even locally here in the Bay Area that has recovered from this, and you know who you are.
In Burlingame, John Ramos, KPIX5.
The Blood Center says it requires medical confirmation that a donor has recovered from the virus and has antibodies for COVID-19. Then any single donation received can help 3 seriously ill patients.